Good morning. I'm Dr. Bonnie Henry. I serve as BC's Provincial Health Officer, and I'm honored to be speaking to you today from the traditional lands and waters of the Lekwungen-speaking peoples, known today as the Songhees and Esquimalt First Nations. And I'm very grateful to live and work on these incredible lands as we work to uphold the inherent rights of all First Nations, Inuit, and Métis people in this province to the health and wellness that we all deserve. Today I'll be talking and sharing some information about the 24-25 respiratory illness season and, really importantly, the immunization campaign that really kicked off last week. While we know that there's still a lot of uncertainty about many things going on right now, I know for certain that we will be seeing influenza and RSV, and we're already seeing increases in COVID infections and other viruses that cause illness around this time of year, including the enteroviruses and all of the cold viruses. Over the past 4 years, we've learned again and again how important it is to have the protection that our vaccines offer us, and that we have updated vaccines this year that are available across the province for influenza and also for updated COVID vaccines. I can't say it enough that immunization, these vaccines, are the best ways that we have, the single best way we have to keep ourselves, our families safe from serious illness, and the best way to protect our health system, which ensures that people who need care the most can get it. That's why I'm here today. So just to remind people that the annual launch of our efforts to protect people from illness during this year's respiratory season really kicked off after the Thanksgiving weekend last week. And I know many people have got their vaccines already, but I'm encouraging everybody in the province aged 6 months and older to get immunized with the updated influenza and COVID-19 vaccines. Over the past few years, people have rolled up their sleeves and done their part to protect themselves and the people they care about by getting immunized. Every year, we try to make it more efficient and convenient for people to access the vaccines that they need. And people will note, many people, invitations for the priority populations to book your immunizations have already started. It started early in October once we received the vaccines in the province, and included people at highest risk of severe illness and complications, so older people over age seniors and elders over age 65, residents in long-term care facilities, people with chronic health conditions, so people who are going through cancer treatments, people who are immune compromised, who have respiratory or chronic cardiac conditions, and healthcare workers, very importantly, as we know how important it is to be updated on our protection in our healthcare system. And I'm happy to report we're already seeing record-breaking numbers from our opening week, which started last week. In pharmacies, pharmacies delivered over 369,000 vaccine doses in the 1 week last week, beating our previous total by almost 4,000 doses. This represents about 141,000 updated COVID vaccines and 228,000 influenza doses in the opening week. Like usual, after the priority populations receive their texts, we continue inviting people to book their appointments in order by age. So many of us will be getting it in the next few weeks and over in the next few days, and we expect that everybody will have their invitations out there by the first week of November. In addition to getting immunized, it's time to dust off the healthy habits that we've learned over the last few years to curb transmission of viruses and other pathogens that can make us, our colleagues, or our loved ones ill. So that includes some simple things that should be ingrained in all of us now: covering your cough, cleaning your hands regularly, staying away from others if you have a cough, or in particular if you have a fever. That's a sign that you may have something that's infectious to others, and it's a sign to stay home and stay away from others. Wearing a mask if you have lingering symptoms or if you need extra protection, and most importantly, as we're talking about today, getting those updated influenza and COVID-19 vaccines. We will also be launching our Healthy Habits campaign to remind people about how important these measures are to protect ourselves and others just during these respiratory season. It's important to keep in mind that each of us has the power to stop the spread of respiratory illnesses and, other gastrointestinal illnesses that we see this time of year as well. As we look at the epidemiologic trends that are happening, and these are things that we've been paying attention to, as you know, the BC CDC posts updated information about all of the respiratory viruses as we go through the season, and that's updated on a weekly basis on Thursdays. And that gives us some guidance about what we can expect to see. And I can tell you that right now we're seeing the following trends. There's really sporadic activity of influenza and RSV so far this year. So that's going back to what we would consider a more normal pattern from before the pandemic. And I expect that we're going to start seeing influenza and RSV start to increase probably late November, early into December, seeing the patterns that we're seeing now. But COVID-19 remains elevated. It was elevated through the summer. It never did go back to what we would call a seasonal spread. We had a slight increase in the spring, and it leveled off a little bit in the summer, but we're starting to see that increase again. SARS-CoV-2 levels, so the virus levels in wastewater, remain high at many sites, and hospital admission rates are elevated. But they have leveled off a little bit in the last little while. So that tells us again that we still don't know enough about the patterns that this virus are going to have long-term in this province and in this country. Again, it remains really important for us to have that increasing protection, particularly people who are more at risk of severe illness. In terms of genomics, which is something that's really exciting that we've been watching through the pandemic, we've been watching the changes in the virus over time. We are still in the Omicron era, but the Omicron virus has been changing, and right now the one we're seeing most is a KP virus. It's called KP 3.1.1, and we've started to see an increase in a newer variant called XEC. And so that one's about 10% of what we're seeing now in the testing that's been done. And that one's we've seen has spread more rapidly. But as far as we can tell from following this variant in other parts of the world, it doesn't cause more severe illness. And we still believe that the updated COVID vaccines will provide good protection, at least in the short term, against infection with all of these slightly mutated strains of Omicron. The other thing I want to note is that we are starting to see an increase in visits to primary care and emergency for people having respiratory symptoms. And right now, a lot of that is caused by what we call the common cold viruses, the enteroviruses and rhinoviruses. So pay attention, even if your COVID test is negative, you may have another virus that can spread to other people as well. I will be continuing to monitor this epidemiologic data as we go into the season, as we start to see changes. And one of the things that we did last year, the last few years, and that we did even prior to the pandemic, is we look at when the risk is greatest in the community to see if we need to put in additional precautions and measures in our healthcare system, particularly in healthcare settings like hospitals. So some of those measures include obviously encouraging all healthcare workers to continue to get their updated vaccines to have that extra protection that we need in the system, and measures like everyone wearing masks in areas where care is being provided. Those can make an important difference when the risk is very high in the community. We're not at that point right now, but we'll be monitoring through the season. The other thing I want people to be aware of, and we've been monitoring for some years now, is the high-path avian influenza that has been circulating across Europe and across North America. This is an H5N1 strain, and we started to see, as the migratory waterfowl patterns start again, the fall migratory patterns, we've seen recent infections in Washington State, and some milder infections in farm workers who've been working with affected poultry farms. We have had 3 recent detections in poultry farms just this week in British Columbia, and we're working very closely with our colleagues at Agriculture and the CFIA to make sure that those are contained as much as possible. People may also be aware that there's been this high-path avian influenza, H5N1, has also been found in dairy cattle in many states in the U.S., and we've been watching, and we have a national group that's been monitoring for this in Canada. So far, we have not seen any cases of high-path avian influenza in dairy cattle across Canada yet, and we'll be continuing to monitor for that here. I did want to talk about the vaccines that are available today in British Columbia, and the updated COVID vaccines. Right now we have the mRNA vaccines, both the Pfizer and the Moderna products, that are the updated from XBB last year to the JN1 strain. That's closely related to much of what we're seeing circulate right now here in British Columbia. There also is a Novavax, a protein-based, a more traditional type of vaccine that's been approved for use in Canada. However, the company is not yet marketing it in Canada for a variety of reasons, which means it's been a challenge for us to get access. And I know there's been a number of people who've written to me and to others to try and access this protein-based vaccine. And I can tell you we are working on it, and I would encourage you to encourage the company to continue to look at how we can get access here in Canada. And I'll let people know if and when we are able to access that vaccine. In the meantime, we know the mRNA vaccines are the most updated strains available, and that they are very safe and effective for everybody. In terms of influenza, we have updated influenza vaccines again this year, and including enhanced vaccines for seniors. So there's 2 types of enhanced vaccines. The high-dose version that is being used in long-term care homes particularly, and an adjuvanted version, which is available for people over age 65 in the community across British Columbia for free. Both of these give added protection to older people and people who are immune compromised compared to the regular vaccines. But if they aren't available, the regular vaccines also give you additional protection for this season. If you've had COVID recently, you've had a boost to your immunity, so that's a good thing. I know many people that have had COVID recently, and so my advice to you is to wait a few months. You don't need an additional vaccine right now. That infection gives you a boost to your immunity that lasts for several months, and so getting a vaccine right now won't give you any additional protection that you already have. But you can, after about 3 months, we recommend at least 3 months to give your immune system a time to adjust. You can get an updated booster then, particularly if you're somebody who's going to be traveling or going to be in a high-risk setting. One of the other things that I get asked questions about a lot is the rapid antigen tests. They are still available, and we have purchased additional rapid antigen tests available in pharmacies around the province. The older ones do still work to detect the later strains of the Omicron virus that we're seeing circulate right now. And they are recommended for people who have symptoms. They work best when you have symptoms and you want to know if it's COVID or not. Even if they're negative, however, you may have another virus that you can still pass on to other people, and they're not perfect. So you can have a false negative, and if it is negative and you still have symptoms, you can retest after about 2 days, and if it's still negative, it's unlikely to be COVID. I know many people test repeatedly until they test negative after having a positive, and there really is no need to do that. For the most part, we know that people are no longer infectious to others after their symptoms have resolved, mostly. We know that sometimes people can have lingering fatigue or cough that goes on for some time, but usually if your symptoms have gotten better over 5 days and you don't have a fever, you're no longer infectious to others. And the tests can still pick up some of the virus particles, even though it may not be live virus anymore. So in conclusion, I just wanted to to encourage everybody to get out there. The vaccine is available in over 1,300 pharmacies around the province, in public health clinics, from your care providers, and we will get through this next 24-25 respiratory illness season by doing the best we can to protect each other, getting our updated vaccines, making sure we take all of those healthy measures, covering our cough, staying away from others if we're sick, and washing our hands regularly. Following the science to make evidence-based decisions. That's the thing that we know works to help protect us and get us through these, what will undoubtedly be another challenging season for all of us. So thank you very much, and I'm happy to take some questions.
A reminder to media on the line, please press *1 to enter the queue. You'll be limited to a question and a follow-up. We are going to start here in the room with Vaughn Palmer from the Vancouver Sun.
Well, good morning, and good to see you again.
Good morning.
I got my invitation to get vaccinated for COVID-19 a little while ago. Safe to assume you held off doing this till the election was over?
Not really. There was a lot going on last week, as we know. So, yes, the official start of our public campaign was really last week, and there was a number of media events in local areas, particularly my MHO colleagues around the province. But I wanted to add my voice to that, and a little bit of lull, perhaps, in reporting. So I encourage everybody to talk about the importance of the things that we need to do to get through this next respiratory season.
A colleague of mine, ours in the media, had a piece in the Toronto Star on the weekend, Heather Malik, about her struggle with long COVID. She made the point that she's not one of the worst cases, but it's still a trial. What's the state of our knowledge on long COVID?
Yeah, that's a really good question. And, you know, this is a disease that's only been in our existence for a few years, so we're learning as we go. And we still have a clinic here in British Columbia. It's virtual now to support people with long-term symptoms. Globally, we're starting to see a coalescence of definitions, although they still vary, whether it's having persistent symptoms for 3 months or longer. That seems to be the minimum. Things that we do know are that there's several different syndromes that people have. The most common being a neurological, which is brain fog, having difficulty concentrating, profound fatigue. And we do know that things like moderated exercise and other measures seem to help. There's not been great success in medications that seem to make a difference for people with long COVID yet, although there's still work being done on a number of different medications. I will say one thing that we do know, and there's increasing evidence. There was a good study that came out of the U.S. Veterans Affairs just a couple of weeks ago that showed that vaccination, even after initial infection and even in people with long COVID, does provide protection from repeat infections and reduces risk of symptoms by at least 50%, likely more in most people, and can provide benefit for people who are suffering from long COVID symptoms. But as you say, this is one of those sequelae from the pandemic that we are continuing to learn globally about.
Our next question comes from Rob Buffum, CTV.
Hi, Dr. Henry. Nice to see you.
Nice to see you.
What's the takeaway in terms of, it seems like a lot of people have been sick, at least in folks I've spoken to. What is the takeaway in terms of how prevalent COVID is right now, and how bad is this upcoming year going to be for it?
Yeah, hard to know. We look at what's happening globally, and particularly what happened in the Southern Hemisphere around the same time. And they had, I would say, a moderate season in terms of more like the pre-COVID, pre-pandemic seasons. So that's one of the reasons why I'm thinking we're not likely to see that surge that we often see in influenza, particularly in RSV, until a little bit later this year. Last year, we saw the surge start really in early October. In terms of COVID, it's a little bit all over the place. What we saw was a bit of a rise early on in September. It's leveled off here now, but it's still out there. And we know that people are getting sick. One of the things that we watch, of course, is hospitalizations, which have crept up into the 200s here in BC, people in hospital with a positive COVID test. So not all of them are because of COVID. It has leveled off in the last 2 weeks. So It's hard to tell what we're going to see now. But we know that as people start to gather again, particularly over the holiday season, that we'll probably see more transmission of viruses. We see that pattern often. So now's the time to protect yourself so that you're not spreading it to others, particularly as we head into the holiday season in December.
I wanted to ask you, the nail-biting election that we've just gone through that's still being sorted out. The Conservatives have said that they would fire you if they are elected. I want to get your thoughts because we're in a situation where it's not inconceivable that they could form government. What are your thoughts on the current situation we're in?
Yeah, there's a lot of uncertainty, as I mentioned, but my office, the Office of the Provincial Health Officer, is an independent office, and my role is to serve whatever government is in power, and I will do my best to do that. If the party decides that they would prefer somebody who is more aligned with them, or that, then that is their prerogative to do that. What is most important to me, and one of the things that I'm focusing on right now, is my role is to protect the health of everybody in British Columbia. That's why we're talking today, how important it is to do our best to get through this next respiratory season, and I'm going to continue to do that. The democratic process is incredibly important, and I'm very happy to see so many people participating by exercising their right to vote. I think it's important for all of us. But while we wait for the final results, my office and the work that we do will continue, and particularly right now, the work that we're doing ensuring that people have access to the vaccines that they need to protect themselves and their families and our communities across BC.
Our next question comes from the phones. Graham Wood, Glacier Media.
Oh, hi, Dr. Henry. Just sort of carrying on that subject of the politics at hand, with the criticism that you got, have you reflected on, just because the criticism is sort of based on John Grosstad's concerns over civil liberties, at least that's what I gather. Have you looked and reflected back at how civil liberties were handled during the pandemic? And in hindsight, did you think that you struck the right chord, or could things have been done differently?
I think, and I've said this before, that I worry a little bit that we're in a phase of collective forgetting, which is not uncommon after a major traumatic event. And all of us want this to be behind us and not have to think about this anymore. But I have done a lot of reflection about the things that we did to try and manage during times of great uncertainty. And I think we have to remember that. And we did what we did to try and find that balance. We know that there were extreme harms caused by this virus, particularly for older people, for people who were immune compromised. But we also know the impact of the measures that we put in place had differential negative effects on younger people particularly. And I've talked about this many times, about the concerns I have about young people in their late teens and early 20s and the opportunities they missed. So always my role, our role, was to try and find that balance of protecting people as best we can. And the one thing that I am absolutely certain of is the fact that the vaccines that we had and the ability to provide protection through immunization is what got us through this pandemic and what made it so that we can live with this virus and stop some of the restrictions that were necessary at a time when we didn't have the protection from vaccines. So it's hard to, at this point, to remember some of the trying and uncertain times that we went through. But my role and the role of public health was always to find that balance as best we could.
Follow-up, Graham?
Yeah, just switching excuse me. Just switching topics to the bird flu cases in Washington State. Can you elaborate on who have you spoken to? Like, is this a CBSA issue? Is this more, are you calling the shots as to how things are monitored at the border? And just how concerning is this?
Yeah, so we have regular conversations with my colleagues in Region 10, which is includes Washington State. So what we know about these cases is very mild. It is in workers on affected poultry farms, so it's not really an issue around the border or around border crossings. And what we need to be concerned about, and what we're working on here in BC, is our partnerships with agriculture, with the poultry industry in particular with CFIA, around ensuring that we're monitoring workers on affected poultry farms here and affected farms here, and that people who work in these settings are vaccinated. We want to make sure they get the updated influenza vaccines so that there's no chance of being infected with both viruses that can lead to concerning changes in the virus, perhaps. So we are very much aware of what's going on in the United States, and particularly in Washington State. It is in the southern part of the state, but I'm not concerned about the border so much. What we're concerned about is making sure we're monitoring workers here in British Columbia as well.
Next question, Ollie Herrera, Check News.
Dr. Henry, forgive me, I joined the call just a few minutes ago, so I'm not sure if you answered this, but I'm wondering about the rollout of the invitation, like the timeline specifically. I see that it began this month, but I'm just hearing, like, anecdotally, like, lots of people have been getting sick for more than a month. So I'm just wondering, why can't the province roll out these vaccine invitations, like, in, like, early September or late August, you know, ahead of the cold season to prevent any more people getting sick? Or is the province even considering rolling out earlier next season?
Yeah, so there's a combination of answers to that. The most important of which is the vaccine was not available until late September, early October. So these vaccines, the updated vaccines, go through a process of being assessed for their safety and their effectiveness by Health Canada. So the Health Canada approved vaccines were available late September, and we started immunizing as soon as they arrived in the province. And we start with those at highest risk. So as soon as vaccine becomes available, public health teams are working with long-term care homes, with our pharmacy colleagues, to make sure that people in long-term care get the vaccines first. And then we roll it out by invitations, trying to make it as easy as possible. So really, for most people, all of the pharmacies in the province, all of the public health clinics started for the broad public last week and continue this week. And as I mentioned, we had a record number of people receiving their vaccines last week. Also talked a little bit about the epidemiology, so what we're seeing in terms of the virus. So what we really want is the best protection at the point where the virus is at its peak, where you have the most transmission in the community. And right now we're not seeing a lot of influenza or RSV. So influenza, it has been peaking in October, and so yes, there was some pressure to try and get people immunized earlier in the past 2 years. We're now seeing it a little bit later, more like a pre-pandemic timing that we saw before we saw COVID on the scene. It's really challenging around the COVID vaccine. So the updated vaccines, again, were available late September, early October. And as soon as they were received in the province, we started providing them to people who need them. Prior to that, and you may remember, there was a little bit of controversy in that we did have the older XBB vaccine available for people who needed it for urgent reasons, but we encourage most people to wait for the updated vaccine. So it is a little bit around logistics and timing and how long it takes for vaccines to be developed and updated and then approved for use and then receiving them here in the province. So the other timing part, obviously, is when we expect that the viruses are going to peak. And with COVID, it's still a little bit of uncertainty. It's been waffling around, though it's consistently seeing an increase in later in the fall and early winter. So I will just say that right now is the best time to get those updated vaccines.
Follow up, Ollie?
No, thank you.
All right, and for our last question, we go to Mary Brooke, Island Social Trends. Go ahead, Mary.
Hi, Dr. Henry. Would you say now that COVID has become normalized within the respiratory illness season? You're saying it has some differences from the patterns of flu and RSV, but still some distinct factors. But are we looking at sort of a trifecta every year now going forward?
Yeah, it's hard to say. We still don't know everything about this virus in the 4 years or so since it appeared on the scene. What we do know is it doesn't seem to be going away, and it still causes severe illness, in particular in people who are immune compromised, who are older, who have other underlying illnesses. And that's why the updated vaccine is so important. But yes, I think it's what we call endemic. We're no longer in that emergency situation. And in large part, that's because we have effective vaccines that are protecting people, particularly protecting people from the more severe illness that was causing people to be in ICU and deaths. So we're seeing those more severe forms of the illness go down quite a lot, which is good news. But we don't know for certain the patterns that we're going to see long term, whether it's going to be require a booster every year, or whether it might slow down the changes that we're seeing in the virus and not need to have a booster for a longer period of time. So there's still some uncertainty, but yes, I would say it's endemic. It's going to be with us for the long term, and that we need to be prepared for that. And thankfully, we have good vaccines that help protect people, particularly from the more severe illness.
Do you have a follow-up, Mary?
Yes. During covering the BC election campaign, I did encounter a few doctors who still don't support the COVID vaccine. And so I'm just wondering if you're still hearing opposition from private care providers or others who might be eligible to deliver the vaccine who don't want to.
There are a small number of people, but I think the vast majority of the healthcare workers that I encounter, that I talk with on a regular basis, really appreciate that these are new technology that is incredibly effective, that these are safe vaccines, and that this technology was under development for many decades prior to being used, but under development for cancer vaccines, and it's still being used to try and address some of these other major important issues. So I think the vast majority of physicians, of nurses, of people who work in our healthcare system are strong believers in the importance and the protection that vaccines give us, and COVID vaccines are no exception.
Thank you, everyone. That concludes today's event.
Thank you very much.